The Community Memorial Health System Speaker Series Online is brought to you by Mission Home Health. Mission Home Health and Hospice is committed to taking care of people by providing the highest quality, cost-effective care wherever the patient calls home. With over 14 locations, Mission delivers skilled home health, hospice, and palliative care services to more than 3,000 patients a day. As a preferred partner with several health systems, Mission works with providers to customize each partnership to provide exceptional coordinated care. Visit our website to learn more at www.homewithmission.com. We take care of people, and one call does it all.
Thank you for joining us this evening to learn more about the Maternal Child Health Department and the services we offer here at Community Memorial Hospital. I'm Megan Rodarte, and I am the Director of Maternal and Children's Health Services. I've been a registered nurse for 30 years, and I've been the director here at CMH for 15 years. I'm here with a couple other of our nurse leaders, and they are going to introduce themselves.
Hi, I'm Jane. I'm the nurse manager for the postpartum and pediatric unit. I've been a nurse for almost 40 years, most of it in maternal child health area, and I've been the manager of this area for almost 10 years.
And I'm Brandy Stanley. I am the clinical nurse manager of labor and delivery, and I have been a labor and delivery nurse for 22 years.
We're pleased that you're joining us tonight, and we look forward to answering your questions. We encouraged you to submit your questions via Zoom, and we will address them at the end of our program.
And to get things started, we would like to take you on a virtual tour of our maternity floor. We would like to share an inside look of our private birthing suites and our postpartum recovery rooms.
Hospital, and share what you can expect when it's time to deliver your new baby, from pregnancy to parenting. Community Memorial Health System is here to support your unique journey as a family. At the conclusion of this video, we encourage you to visit mycmhbaby.org for more valuable information to help you prepare for your birth experience and to explore all the resources available to you. That's mycmhbaby.org. To streamline admitting when it's time to deliver your baby, we ask that expectant mothers complete our hospital pre-admission process at least 1 month prior to their due date. You can stop by the admitting office to provide your personal information, or you can start the process at mycmhbaby.org. If you think you are in labor, the first step is to call your doctor. He or she will tell you if it's time to come to the hospital. You should also call your doctor if your water breaks, if you have contractions that have been 5 minutes apart for an hour, or for any other concerns. When you arrive at the hospital to deliver your baby, you can pull up to the front door of the hospital and let the mom-to-be out of the car prior to parking. During busy weekday hours, the CMH valet is available to park your car. In the evenings and on weekends, or if you prefer to park your car yourself, please use the parking structure in front of the hospital. Be sure to adhere to all posted signage and time restrictions. The main entrance to CMH is open during daytime hours, and the emergency room entrance is open 24 hours a day, 7 days a week. Anytime you come to the hospital during the pregnancy, and when you arrive to deliver your baby, if you are arriving to the hospital during daytime hours, you will come directly to the 3rd floor, labor and delivery unit. And if you are arriving at night, please stop at the emergency room admitting desk and check in before coming to the labor and delivery. Our labor and delivery department is located on the 3rd floor of the hospital. When you get to the door, use the phone on the wall to talk to one of our nurses. They will open the door for you. When you arrive at the labor and delivery department, your nurse will evaluate your condition, assess how your labor is progressing, and discuss the situation with your doctor. If you are in very early labor, we may send you home and ask you to return when you're further along. We encourage you to have a support person with you in labor and delivery. Other visitors are normally allowed, provided that the environment remains safe. We have enough space to provide the needed care, and as long as visitors are supporting you in your birthing experience. However, we ask that you not bring visitors other than your support person until you know you are going to stay. As your due date approaches, please visit mycmhbaby.org to check our most up-to-date visitor policy. Labor. Once the decision has been made that you will stay in the hospital and things are progressing normally, you can get up and walk in your room or the hall, sit in a rocking chair or on a birthing ball, or take a shower. If you'd like to take a bath during labor, ask for a room with a bathtub when you check in, and we will do our best to accommodate your request. If you need an IV during labor, your nurse will explain why it's necessary. You may discuss getting pain medication or an epidural, or other desires for your labor and delivery experience with your labor and delivery nurse, your midwife, or your doctor. Educational videos about labor and delivery are also available on the TV in your room. You can bring a camera to take photos and videotape before and after delivery. However, you may not videotape during the delivery. Delivery. When your baby is born, the umbilical cord will be clamped and cut. Your support person may help cut the cord if he or she wishes to, and the medical staff determines it is safe. Your baby will be placed skin to skin on your chest for you to see and hold. Putting your baby's skin to skin on your chest will help your baby's vital signs and blood sugar stabilize, calm your baby, and help support breastfeeding. After your baby is born, a nurse will examine your baby and notify your designated pediatrician that he or she has arrived. An antibiotic ointment will be applied to your baby's eyes to help protect them from germs, and a vitamin K injection will be administered to support blood clotting. After a couple hours of recovering, you and your baby will be transported to your postpartum room together. Your baby will have a bassinet. The bassinet drawer will contain diapers, wipes, and blankets for the baby. Cesarean sections are performed in special operating rooms located in the labor and delivery department. Your support person may attend the cesarean section, but no other visitors will be allowed in the operating or recovery rooms. In the rare case of an emergency cesarean section, your support person will not be allowed into the operating room. If you and your baby are well at the time of cesarean delivery, and the obstetrician and anesthesiologist approve, your baby may be put skin to skin on your chest after delivery. After some time, a nurse will take your baby and support person to the recovery room. When you arrive in the recovery room, your baby may be placed on your chest again while you are recovering. You will be in the recovery room with your baby and support person for about 2 hours after the cesarean section. And then the three of you will be transported to your postpartum room. If your baby needs extra attention or care after delivery, your baby may be taken to the Neonatal Intensive Care Unit, or NICU, also located on the 3rd floor. Parents may visit the NICU 24 hours a day. The NICU does a great job of taking care of babies that need extra attention after birth. If your baby needs this type of care, you will be provided with all of the necessary information, and a social worker will be assigned to assist you throughout your baby's stay. Postpartum rooms are also located on the 3rd floor. Your baby will room in with you, which means your baby will stay in your postpartum room until you are both discharged. Keeping your baby with you encourages successful breastfeeding and enables you to become comfortable in your new parenting role. If you need any assistance with your baby, your nurse is there to help. Vaginal delivery patients generally go home 1 or 2 days after a baby is born, and cesarean section patients generally go home 2 to 4 days after a baby is born. Postpartum. Your postpartum room bed will have a call light and TV and lighting controls. Please use your call light to ask for assistance to the bathroom, for pain medication, or any other needs. Educational videos about moms and babies are available on the TV in your room and are accessible using your bed's remote. We encourage your support person to stay with you throughout your hospitalization. There will be a sofa that folds out into a bed for your support person to sleep. For all other visitors, please visit mycmhbaby.org to check our most up-to-date visitor policy. Safety. Your baby will have 2 ID bands and 1 alarm band. You and your support person will each have an ID band that matches your baby's. The ID bands will all have the last name that the mother is admitted under. The alarm band will set off the alarm if someone tries to remove the band, or if your baby gets too close to a hospital exit. If any of the bands need to be adjusted, please let your nurse know. If anyone comes to your room to take your baby for a test, please make sure they are wearing a hospital name tag with their photo and name. Only maternity staff wearing a unique hospital name tag and special color of uniform, the maternity staff, should take your baby from your room. If we take your baby out of your room, your support person can come along with us. If you have any questions, ask to speak with your nurse before allowing anyone unfamiliar into your room or to take your baby. If you walk in the hall with your baby, he or she must ride in the bassinet, not in your arms. Postpartum folder. In your postpartum room, you will find a folder containing the following papers you will need to read and fill out: souvenir birth certificate form, legal birth certificate form, Social Security form, California State newborn screening pamphlet, hearing screen information, hepatitis B vaccine information sheet, baby photograph information, breastfeeding education. Several people will come by your room the morning after the baby is born to pick up forms and answer questions. Please have the forms filled out as soon as possible after delivery. Breakfast, lunch, and dinner will be brought to you in your postpartum room. You will be given a menu to choose the food you would like to eat. Your support person can purchase food in the Brent Street Cafe, located on the first floor of the hospital. CMH also has gourmet meals if you'd like to order one in celebration of your new baby. Ask your nurse for this special menu. Feeding your baby. As a baby-friendly designated hospital, CMH encourages and supports exclusive breastfeeding, and our nurses are trained to provide breastfeeding assistance during your stay. At the same time, we are committed to supporting each individual's parents' feeding decisions for their baby. Please don't hesitate to ask for help as needed. We also encourage you to make an appointment at our new Parent Resource Center after delivery for any additional breastfeeding assistance you may need. Visit mycmhbaby.org for details on the resources available at the new Parent Resource Center. What to bring? CMH provides hospital gowns, pads, and underwear for you to wear during your stay, but you may bring some of your own belongings as well. Visit mycmhbaby.org for a list of suggested items to bring from home. Diapers, wipes, and blankets for your baby are also provided during your stay, but you will need to bring clothes and a blanket for the baby to go home in. You will need a car seat for your baby. The car seat should be new, or you should be sure that it has not been in an accident and it has not reached the expiration date listed on it. We highly recommend you have assistance with your car seat installation by the California Highway Patrol. Many fire stations also install car seats. Visit mycmhbaby.org for a list of phone numbers. Please call to make an appointment. Car seat installations are free of charge. Please label any belongings you bring to the hospital with your name. Do not bring valuables to the hospital. On the morning of your discharge, please ask your support person to take all your belongings to your car. Please double-check that nothing is left behind. Feel free to take the disposable supplies from your room, such as diapers and wipes, but leave the linens, blankets, and baby t-shirts in the room. If you had a cesarean section or are still unsteady on your feet, you will ride out of the hospital in a wheelchair. In this case, your baby's car seat can be waiting in the car, and you will carry your baby in your arms while sitting in the wheelchair. If you did not have a cesarean section, and you and your nurse both feel that you are steady on your feet, you may walk out of the hospital. In this case, your support person will carry your baby in his or her car seat. We know that bringing home a new baby is exciting, but can also be a challenging time for you and your family. We're here to help. The Community Memorial Health System New Parent Resource Center is available to answer any questions you may have and offers a variety of resources, including prepared childbirth classes, prenatal yoga, support groups, private lactation consultations, and new parent classes. Breastfeeding may come with some unexpected challenges. Our team of registered nurses, who are also international board-certified lactation consultants, are here to provide support and education to help you meet your personal goals. We offer private, in-person, and virtual lactation consultations in a warm, caring, nurturing environment. In addition, we offer breast pump rentals and a breastfeeding boutique with items to meet all of your breastfeeding needs. Visit mycmhbaby.org or call 805-948-BABY for more information. Thank you for choosing Community Memorial Hospital for the delivery and care of your baby. Giving birth is one of the most meaningful and memorable times you and your family will ever experience, and we are honored to be a part of your journey.
Well, we hope you enjoyed that inside look at our department and some of the services we offer at Community Memorial Hospital. Now I would like to take a few minutes to answer some of the questions that you've submitted. And our first question is, what kind of shots do you give the baby at birth? And Jane can answer that for you.
Sure. After the transition nurse comes to labor and delivery to admit your baby for the arrival to bring over to postpartum, your baby will be given a vitamin K shot, and also we put an ointment of erythromycin. It's an antibiotic that we put into your baby's eyes. When the baby is in postpartum, prior to discharge, we also offer the hepatitis B immunization.
Brandy, that's
Okay.
a good one for you.
How many visitors are allowed in the delivery room? Well, today we allow 2 visitors in the delivery room and a doula if you have a doula, although with COVID, things change frequently.
Yeah, so our visitation, we have actually some really good news for you that just we're announcing today, and that visitors no longer are required to provide proof of vaccination or a negative test upon entry to the hospital. However, things could change again, and we're following all of the California Department of Public Health processes, and so you still will be screened upon entry to the hospital for symptoms of COVID, but please go to our website, mycmhbaby.org, for the latest visitation information prior to coming to the hospital.
And I see another question. Looks like it would be a postpartum question. And the question is, what is the process for a boy to be circumcised? Once the baby is in postpartum, the pediatrician will come and see your baby. They will see the baby within the first day of life. They will ask you if you would like to have your son circumcised. You would sign a consent, and the baby would be brought to the nursery on the postpartum floor. Parents are able to come with them if you so desire, and the physician would perform the procedure right there with a nurse, and there will be a short recovery in the room, and you'd be given some instructions for care once you go home, and that's our process.
Another questions for labor and delivery.
Yes. So are you required to wear an IV during delivery? So on arrival to labor and delivery, we will certainly be asking you lots of questions about your plan for delivery. And we do highly suggest that you do get an IV. This is something you can further discuss with your physician before coming. But we usually give some IV fluid, and depending on what's going on during your labor, you may require other medications through that IV. So it is best that you have at least a saline lock if you do not need fluids or antibiotics or anything else.
It's a good safety measure to have access just in case there are any emergencies. It isn't absolutely required. It's something that you can discuss with your physician, but it is recommended that you have at least that saline lock and an ability for us to be able to access your veins quickly.
Brandy, it looks like there's another one for you. Am I able to labor in a different position than on my back?
Yes, that's a great question. And we do encourage movement during labor. We really don't want you laying on your back in one position. And our labor nurses are really great at helping you to get in various positions throughout your labor. And those positions really do help bring the baby down into the pelvis in preparation for birth.
Looks like we have another question coming up. And it looks like in postpartum, is there a lactation consult available? The lucky thing about Community Memorial Hospital is that we are a baby-friendly hospital. All of our nurses are trained, especially in lactation. So every nurse that you come in contact with would be able to help you. We do have part-time lactation consultants that are available to help when we have special needs, and that can consult with our nurses to be able to better support you on your breastfeeding journey.
And do we support delayed cord clamping? Actually, we do, and it's something that we've just been discussing more and more recently as the new changes and guidelines came out, and we absolutely do support and provide delayed cord clamping at birth.
Okay, are siblings able to visit in the hospital? What if the sibling is not vaccinated for COVID due to age? So currently, again, we'll go back to our visitor policy. The best place to look for all of this information is on our website, mycmhbaby.org. But at this time today, we do not allow siblings to visit.
In fact, there's no children allowed in the hospital at all currently, but again, that could change. So we're hoping. And Brandy, another one for labor and delivery.
How many rooms have bathtubs? So we do have 14 rooms in labor and delivery, and of those we have six or seven with
half.
tubs.
Yeah.
In labor and delivery. If you'd like one when you come in, just let us know. We'll do our best to accommodate that request. And in postpartum, they're all showers.
Yes, showers.
All right, another question. If there is an emergency during delivery, do you have experts trained in bloodless interventions? Yeah, we do actually. So all of us are trained in emergency situations, and all of our providers that do deliveries here at CMH are all experts in bloodless interventions.
It's something that we do regularly when we have patients that request bloodless interventions. Are you allowed to eat and drink during labor?
Yes, so we do encourage our patients to specifically drink lots of fluids, because as you're laboring, you certainly do lose, fluids because you're working really hard. So definitely during labor, we're going to encourage you to drink. And we do want you to eat in the earlier parts of labor. Oftentimes when our moms are in active labor, they no longer want to eat. So, it just naturally occurs that laboring women no longer want to eat.
If you have a special request, that we again recommend that you talk to your physician prior to coming to the hospital for delivery, so that you guys are on the same page. Next question. How do I sign up for prenatal classes and yoga? If you go to our website, you can sign up for our prenatal classes. We offer prepared childbirth. We offer hypnobirthing. We also offer the prenatal yoga that you're requesting. So if you go to, again, mycmhbaby.org, it's all the information about the classes, all the classes that we offer, and what the cost is of each of the classes. Some of the things, we have some support groups for breastfeeding and for a Well Mama support group. Those are free. So there are some things that we offer at our New Parent Resource Center that are for a fee, and there are other things that are free. So again, mycmhbaby.org, and you're going to find all that information.
And it looks like we have a question. Do I have to bring clothes for the baby? While your baby's in the postpartum area, we recommend honestly that your baby, for skin to skin purposes, it does not wear clothes. We swaddle the babies and we have them on the moms. However, we do have photographers that come, and people like to dress their babies in all the cute little outfits you get, and they always go home in adorable little outfits. So it's your choice whether you bring clothes. Most people do bring that special going home outfit. Other than that, you do not need to bring clothing or diapers for your baby. We have them there.
Brandy, this is one specific to the birthing process.
Yes. So is perineal massage offered, or can you have your birthing support person do that? So yes, we do provide and are skilled in supporting the perineum during the birthing process. So all of your labor nurses and labor support while at CMH will help with that. And certainly, we want to include your support person in helping with that process.
Can you choose the doctor that delivers your baby? And where can I access a list of physicians that deliver at CMH? On our CMHS website, there is a doctor locator function that you can type in even by provider type. So for instance, OBGYN, and there's a whole list of physicians that deliver at CMH. And you need to talk to them about their call schedules and how it is determined which of the doctors, because a lot of them are in groups. So if they're a group, you may be delivered by any one of the group members, or sometimes, there's different depending on the group. But you can go to that website and see a whole list of the providers and the provider groups that deliver here. And there are quite a few.
You can go to the doctors.cmhshealth.org site.
Right, that's,
well.
yeah. So it's this, I think if you go to the website or you use the link that Jane just mentioned, you're gonna end up in the same place.
Yeah.
And another question, are you able to wear your own gown or clothes during labor? Yes, you most definitely can wear your own gown or clothes during your labor process if that makes you feel most comfortable. When you come to CMH to deliver your baby, we just really want you to feel comfortable and feel at home. So if you want to wear your clothes, please do so. And we also provide gowns if you'd rather do that.
Next question is about if we support cord blood banking, and we do help with cord blood banking. However, you need to bring your own kit and have that established. We don't provide the kits, or it's an outside company, so you would need to bring your kit with you, and we will help facilitate that process of cord blood retrieval.
And Jane, maybe you can ask this and I can read it.
Yeah.
Do you delay vaccines and eye ointment until first breastfeeding is established?
We most often attempt to do that, and most of our babies do breastfeed prior to this happening. In the labor and delivery area, once you've delivered, we give you, it's an hour and a half to 2 hours of uninterrupted time where we do skin to skin with your baby, and your baby, most babies latch in labor and delivery. And so by the time that the transition nurse comes to admit your baby, as I said earlier, it's 90 minutes to 2 hours. And then we will do the vitamin K and the erythromycin ointment. Parents have also asked for that to be delayed, and we have done that on occasion.
It is our normal process
Right,
to
it is our
delay
normal.
it, to delay all newborn unnecessary newborn procedures until after that first breastfeeding is complete, and that's a part of our baby friendly thing and our supportive breastfeeding.
Yes.
Does pre-registration mean that I don't need to bring any additional paperwork? Pre-registration, yes. Gosh, that is a good question for the admitting department. We do ask people to be pre-registered prior to coming to the hospital. When you come in, there still is a check-in process. I don't believe there's additional paperwork that you need to bring, but you will have to sign conditions of admission and some privacy practice paperwork that the hospital will provide you. But if you pre-register, it should be a very quick process to check you in when you get here.
And I just want to add one other thing. Some physicians will ask you to bring in your prenatal records. So if you happen to have one of those physicians, just that would be the only paperwork that you would need to bring in with you.
Right. Next question. Can I get outside food while in postpartum?
Yes, we have all of the delivery services on hand. Frequently, our postpartum moms are very hungry. Our catering department does provide 3 meals a day, and we do have snacks on our unit for you. But yes, you most certainly can. People bring food in as long as you're not on a special diet, which most of our moms are not. You are able to have whatever you like.
And this next question is, what should I pack for my hospital stay? We, again, on our website, My CMH Baby, we have a list there for you. Of course, we ask that you don't bring any valuables to the hospital. But other than that, there's quite a short list of things that we recommend that you bring for your hospital stay, and mycmhbaby.org will provide you with that list.
Are women able to walk around during the labor process? So I am so excited to say that as of today, women can indeed walk around during the labor process. That had changed, unfortunately, during COVID, and we weren't allowed to let people out of their rooms. But with the frequent changes, they were doing circles in the room. But now you can walk freely with your support person as long as you have a mask. And of course, we provide those masks for you.
What is the nurse ratio in labor and delivery? Well, that very much depends on the stage of labor and what's going on with you. So it's typically 1 nurse to 1 patient, but sometimes the nurse could have 2 patients depending on the stage of labor or what's going on. And how many nurses are in the delivery room when you deliver? Again, that's very dependent, but typically it's 2.
Yeah.
Right, Brandy?
Correct. Generally, in the delivery room, at the time of delivery, you will have your physician and 2 nurses in the delivery room. Once the mother and baby are stable, then your primary nurse will remain with you in the room for the first 2 hours of the recovery period.
What kind of fetal monitors are used during labor? And do you have the option for intermittent monitoring? Absolutely. And if you're talking about the type of monitor, I think
we have a
sure
couple,
what you mean.
yeah, we have a couple different types of monitoring. We have wired monitors, and maybe that's what this question is referring to. We have wired monitors that are attached to the monitor in the room, but we also have a wireless monitor called a Monica Novi that we use. We do have another semi-wireless type of monitoring where the wires are connected to like a telemetry box and put on that IV pole, which you could walk around with as well. But, you know, depending on the stage of labor and what's going on during your labor process, you do certainly have the opportunity for intermittent monitoring and getting up without monitors on.
Are the nurses required to be vaccinated for COVID-19? In following the state guidelines, the nurses are it's highly recommended that they're vaccinated for COVID-19, but it is not a requirement. It is, again, recommended, and if the nurses aren't vaccinated, they've been testing twice a week, but at that point, things are changing in terms of the California state guidelines, and so things are changing daily. So we all wear masks always, so that's one thing for sure. That's not changing yet.
No. Is my support person able to leave the hospital while I'm in postpartum and then return later? Yes, they are able to. They'll have a special band. Your support person will have, once the baby's born, you'll have a special band, so you'll be able to come in and out. You'll also have a visitor band on, and that changes daily. But yes, they are able to come in and out.
What is the policy if I want to formula feed from the start? We are all about choice, and we really want to make this is your baby, this is your life, and this is your choices. So we very much support breastfeeding, as we know that it provides so many benefits. But if somebody wants to formula feed from the beginning, then you just let us know that, and that is that. We will support your individual choice. If you have some specific type of formula that you want to feed, then we recommend you bringing it, but we do provide standard baby formulas from the major companies.
If I test positive for COVID, will I have to wear a mask while in labor? If you test positive for COVID, yes, you will be provided with a mask to wear during labor, as will your support person. So one of the great things that came with this change is even if you're COVID positive, your support person can remain with you throughout the labor process and in postpartum, which is really great. But you both will have to wear an N95 mask throughout your stay.
If I'm not COVID positive, do I still have to wear a mask? It is a different type of a mask that we ask you to wear. We understand there are certain types of, there are certain points in labor where that can become difficult, and we definitely will work with you the best we can. It is recommended. We ask that you wear an aseptic or the lighter weight mask if you're COVID negative still, but of course we're going to work with you, particularly during those rough parts of labor that you might be wanting to tear everything off. So
yeah.
We have a question. Could I decline the eye ointment and the vitamin K? These are highly recommended and prescribed by all of the pediatricians. That is an order from them. However, you are the parents, and this is your child, and you are the person that gives us permission to do this. And yes, you are able to decline. We would have you sign a form of refusing that treatment, and the pediatricians would see the baby in the postpartum area, and they would probably also have a discussion with you. But yes, it's your child, and you will be able to decline if you desire to.
All right, another question. How long does hospital staff allow you to move through labor before being induced? So certainly, I think the question is, if you're in labor and you might need medication, perhaps because your labor has stalled, there will be a discussion with you and your care providers, which would include your labor and delivery nurse and the physician caring for you, about where to go from that point on. So you'll never be made to, have an intervention like a medication for augmentation of labor. It will be a discussion and a shared decision between you and your provider.
The next question is, what is the hospital protocol for placenta encapsulation? We don't provide a placenta encapsulation, but we do allow people to take their placentas home. We have a form that you sign saying that you understand that you're taking home a biomedical specimen, that you will follow the regulations for taking care of that, but definitely you can take your placenta. You just need to be sure to let us know at the time of admission, and we have a way of marking the room so that everybody knows that you want to take your placenta home. And then we ask that you remove it from the hospital within 6 hours of birth. So it's always nice if you bring a little cooler if you want to take it home, and then within 6 hours make arrangements for it to be removed from the hospital. So it looks like this might be our last question. No, it's not. Is the recording of the birth allowed? No, you're not allowed to record the time of birth. You can certainly record the labor and up to birth, but at the moment of birth, we do not allow recording. And right after birth, you can absolutely start recording again.
How late into labor can I receive an epidural? So there's not really a time frame. I can't say there's an exact time where you cannot receive an epidural. You can certainly request an epidural at any time. Sometimes women will ask for an epidural at the very last stage when they're trying to go natural, and it might be time to push. So if it's time to push and deliver a baby, there is no time for an epidural. But if you request it at any time and there's time to get the epidural placed before the birth of your baby, you can certainly have it.
We're going to do our very best to accommodate. And I've even have seen somebody get an epidural during pushing when they need a little break for a while. So it's very, very dependent on your situation, but we don't have any kind of cutoff. Like you may not have it after 8 centimeters or nothing like that. So it's just very individualized based on your requests and what's going on with you at the time.
And we work very quickly in labor and delivery to get that epidural if you want it.
And are there different strengths of the epidural? We, it is a pretty standardized epidural dosing that we have. So that's something that you can talk to the anesthesiologist, who's the type of physician that would put in an epidural at the time, or you can talk to your OB provider prior to that if you have some special request, but it is a fairly standard medication concentration for the epidural.
Yes.
So do you offer nitrous oxide as a pain relief method?
Not yet. We were working on bringing nitrous oxide in just before the pandemic hit, and then the recommendation at that time was not to use nitrous oxide because of the aerosolization of things and when you're breathing like that. So we put a pause on that, but we do plan to begin the discussions again very soon about bringing nitrous oxide on board as one of our pain relief modalities.
Is the mother the only person who can make requests, or can the father also make requests?
Well, I would say that is very dependent on what the request is related to. The woman who, or the birthing person, is actually the patient, and it is the patient who gets to make most decisions. But we would hope that those decisions would be shared between the mother and the father, or the birthing person and her support person. So, but if you're talking about something for the baby, then again, that's something that is a mutual decision. So, kind of need a little more information on what that question is referring to in terms of the type of request. To answer that specifically, the father cannot make a request on behalf of the mother, for instance, and say, I want her to have an epidural, and she says she doesn't want one, or vice versa. That is not allowed, but there are other things that we could potentially have the father request.
All right, so this is our last question. How late into labor can I labor in the bath? So you can labor in the bath as long as you would like, until you start to feel pressure. We certainly don't want to deliver in the bathtub or the bathroom, because there's just not enough room for us to maneuver in that area. So it's best that we get out of the bath before that time. Again, it's kind of like with the epidural, there's not always a hard stop or an exact like dilatation number that I could give you, but we just kind of go based on feeling, how you're feeling, what's going on in your labor process, and go from there.
What's going to be the safest for your delivery? So that's one of our top of mind always is the patient experience. We want you to have the experience that you want, and we also high on the list is safety. In fact, it probably is the number one. We always want to make sure that you're safe, and that your baby is safe, and that you will have the ultimate goal of a healthy mom, healthy baby, and a healthy family. So that is our goal, and so everything we do is surrounding that. So thank you for joining us today. You can learn more about our maternity services by visiting the website that we've mentioned so many times.
mycmhbaby.org.
Thank you. Have a great night.
Thank you.
We appreciate you being here.